Healthwatch Bradford and District is a small organisation, but the key to its success is that with statutory powers, it has real influence on health and social care services. We can hold them to account and make sure they're taking action.
Being part of Healthwatch is very important to me. It was one of the main reasons I wanted to get involved, to try and help people who may not be able to access services, or more to the point, raise concerns they have. And in this position, it's helped me to encourage some of those people to come forward. As chair of Healthwatch, I have a position on the Health and Wellbeing Board. It's one of the most influential strategic bodies across Bradford Council, so we're able to have a lot of influence in some of the decisions that affect the patients and citizens of Bradford. One of the really good pieces of work we did last year was Invisible at the Desk. We went out and spoke to over 600 patients to get their views about services they were receiving. The effects of that report, the influence of that report, is still ongoing this year.
Healthwatch is Invisible at the Desk report certainly resonated with us as GPs. We recognised that the patient had a problem accessing GPs, but we kind of felt we didn't really know what to do about it. Clearly we wanted to improve access to our services, but it was very difficult to know what to do about it. I think it was very useful in prompting the question of, well, is there something we can do about it, that rather than just say, well, that's the way it is. It was suggested that we invest in training for our receptionists to try and help them to see the problem from the patient point of view and enable them to get better access to the services that were there. Nearly every practice in the district has taken part in the training. Not every receptionist, but the majority of receptionists have attended the course. We were a little concerned that it might be seen to be teaching your grandmother to suck eggs, but receptionists generally have been very positive about it and not felt they'd been told how to do their job.
The Healthwatch team were really pleased that the CCGs decided to act on the feedback from Invisible at the Desk. We know that people's experience with frontline staff is really important, and the patient participation group members at the Grange practice in Allerton have already noticed the difference.
When you come in and you're feeling poorly and you go to that desk, it used to be, yes, no, there's no, and you didn't feel you were just anybody. And I think if they've got that little bit of care and, I don't know, the tone that they used to say things to a person, I think if you come over softer, it helps. So by having this training, I think now they do come across softer, and people are coming in with a smile on their face and going out with unless they're really poorly. I've noticed a big change, and as I say, people have definitely outside have done the same.
Healthwatch wants people in Bradford and District to get the best from health and social care. But many of us don't know how to speak out or where to go for information. We can help by answering people's questions, putting them in touch with local services, and signposting them to the support they need. We do this at outreach sessions, on our website, and through our telephone information line.
One of the most common reasons for people to ring the Healthwatch information line is to get some help to find a dentist. So often they may have tried to find something, but they can't find a local dentist to them, so they've come to us to see if we can help them. And so the only way we can help people, and we're quite happy to do this, but this is, again, adds to the frustration. The only way we can do this is to ring round the dentist ourselves. So often we're ringing round several dentists who are nearby to the people who've asked for information, just to try and find one that's taken on new patients at that point in time.
We're working with other Healthwatch organisations across West Yorkshire and with Healthwatch England to tackle the issues around access to dentists and inaccurate information. By working together, Healthwatch can have a stronger influence at local, regional and national level.
Healthwatch is involved at all levels throughout health and social care, so in general practice, in hospital services and in social care, and is influential at all of those levels. It is a critical but independent friend, and I think whilst it maintains a positive aspect in wanting to improve services but working with the providers and the commissioners, it will continue to have a lot of influence.
I think Healthwatch makes them stand up, sit up straighter, because knowing that they're there, right, the patients are probably going to say something, and they will feed back on the hospital, so it probably makes them sit up straighter and probably do a better job.